Health emergencies arrive without an invitation. They do not check your schedule. One moment, you are going about your day. The next, a sudden sharp pain grabs your attention. Perhaps it is a fall on a simple walk. Maybe it is a loved one struggling to breathe. These moments are defined by their abruptness. They shatter the calm of an ordinary afternoon. There is no warning bell that rings before a crisis. That is why our response must be swift and sure. The seconds that tick by are not just seconds, they are opportunities for intervention, for help, for a better outcome. When a crisis strikes, confusion can be your greatest enemy. Panic can cloud your judgment. You may find yourself fumbling for your phone. Where do I go? Which hospital is closest? Is it even open right now? These are questions you do not want to be asking for the first time when the stakes are so high. The time spent searching for answers is precious time lost. Knowing the location of the nearest hospital or appropriate clinic beforehand removes a significant layer of stress. It allows you to move with purpose, turning panic into a focused plan of action. Think of this knowledge as a form of insurance you hope you never have to use. However, if the need arises, it is invaluable. Knowing where to go provides a clear path through the fog of an emergency. It empowers you and your family. It means that if your child has a high fever in the middle of the night, or an elderly parent takes a serious tumble, you are not starting from zero. You have already done the groundwork. In the world of emergency medicine, we often talk about a concept known as the golden hour. This is a critical window of time, typically the first 60 minutes after a major traumatic injury or the onset of a serious medical condition. What happens during this hour can significantly influence a person's chances of survival and the quality of their recovery. For conditions like a heart attack, where heart muscle is dying, or a stroke, where brain tissue is being deprived of oxygen, every minute that passes can lead to irreversible damage. Getting the right care within this golden hour is not just important, it can be the single most decisive factor between life and death. The clock starts ticking the moment the incident occurs. It does not wait for you to figure out where to go. If you spend 15 or 20 minutes searching for the right hospital, you have already used up a significant portion of that precious golden hour. Quick access to a well-equipped emergency room means that doctors can begin diagnostic tests, administer clot-busting drugs, or perform life-saving surgery much sooner. The faster a patient receives definitive care, the better their odds are for a full and speedy recovery, minimizing long-term disability and improving their overall quality of life. Think about a severe allergic reaction, or anaphylaxis. The body's response can be incredibly fast, with airways swelling shut in a matter of minutes. Or consider a major injury from a car accident with internal bleeding. In these scenarios, the patient does not have the luxury of time. The body is in a race against itself, and medical intervention is the key to winning that race. When you are looking for the nearest hospital, it is easy to think that closer is always better. However, the shortest distance on a map does not always mean the fastest travel time. The reality of our roads is far more complex. A hospital that is only 2 miles away might take 30 minutes to reach during peak rush hour traffic. Conversely, a hospital 5 miles away on a less congested freeway might be only a 10-minute drive. You must consider the typical flow of traffic at different times of the day. A route that is clear in the morning might be a parking lot in the evening. Therefore, your planning needs to be more sophisticated than just looking at mileage. Use a map application to check estimated travel times to several nearby hospitals, morning commute, midday, evening rush hour. You might be surprised by the results. Plan more than one route to your primary choice. What if your main path is blocked by an accident? What if it's unexpected construction? Having a backup route already in mind can save you from a stressful and dangerous delay. Beyond traffic, think about the physical access to the hospital itself. Is the emergency entrance clearly marked and easy to find, even in the dark or in a panic? Is there accessible parking close to the entrance? Some large medical campuses can be confusing to navigate, with multiple buildings and winding roads. A quick drive-by visit during a non-emergency time can demystify the layout. Finding the emergency room entrance for the first time should not happen during a crisis. A bit of reconnaissance makes a chaotic experience feel more manageable. Finally, consider your mode of transportation. If you're driving, the route is your primary concern. But what if you don't have access to a car? Investigate public transportation options. Which bus lines go near the hospital? Which train lines go near the hospital? How late do they run? Have numbers for local taxi services ready. Have ride-sharing apps installed and ready. In some urban areas, walking might be viable. Biking might be viable. Tailor your emergency plan to your circumstances so you have a reliable way to get to help no matter what. Not all medical facilities are created equal. Knowing the difference is crucial in an emergency. The most comprehensive option is a hospital. It is typically equipped with a 24/7 emergency room, surgical suites, a wide range of specialists on call. Hospitals are designed to handle life-threatening conditions: heart attacks, strokes, severe bleeding, major trauma. If you are facing a true life or limb emergency, a hospital ER is where you need to go. However, check for special designations: Level 1 Trauma Center, Certified Stroke Center, Certified Cardiac Center. These places have the highest level of expertise for those specific conditions. On a different tier, you will find urgent care centers. They are an excellent middle ground for serious but non-life-threatening problems: a bad cut that needs stitches, a sprain or possible broken bone, a high fever, severe flu symptoms. Urgent care centers can often provide faster and less expensive care than a hospital ER for these issues. However, check their hours of operation. Many are not open 24 hours a day. Identify one that offers after-hours services if your primary choice is closed for the night or on a weekend. Standalone emergency rooms are another option in some areas. They are licensed as emergency rooms but not attached to a hospital. They can provide a high level of care for many emergencies. They may be less crowded than a large hospital ER. If a patient requires hospital admission, they will need to be transferred. If a patient requires emergency surgery, they will need to be transferred. Know if these exist in your area and understand their limitations. For the most severe cases, going directly to a full-service hospital is often the most efficient path to comprehensive treatment without transfer delays. Finally, consider your insurance coverage. In a true emergency, go to the nearest appropriate facility regardless of network status. But knowing which hospitals and urgent care centers are in your insurance network can save you from significant financial stress later. Most insurance company websites have a tool to find in-network providers. Take a few minutes to look this up and make a note of it. If you are uninsured, research community health clinics or public hospitals that may offer care on a sliding scale based on income. Being informed about the financial aspect can reduce one major worry during a difficult time. The first and easiest step you can take today is to use the technology already in your pocket. Open the map application on your smartphone, search for hospital, search for urgent care, search for 24-hour pharmacy. Do this for near your home. Do this for near your workplace. Do not just glance at the results. Tap on each one to review its details. Look for the phone number. Look for the exact address. Look for the hours of operation. Save your top 2 or 3 choices. Save them into your phone's contacts, or save them as favorites in your map app. This simple action takes less than 5 minutes but makes the info instantly accessible. While digital tools are great, don't underestimate a physical visit. On a quiet weekend, take a short drive to your chosen hospital. Familiarize yourself with the journey. Familiarize yourself with the destination. Follow the signs for the emergency entrance. Note exactly where the emergency entrance is located. Note where the best place to park would be. This reconnaissance removes the unknown. If you must drive under duress, you'll have a mental map. That mental map can bring calm and control. Create a centralized emergency contact list. Include names, include addresses, include phone numbers. List your primary hospital. List a backup urgent care center. Add the national emergency number, 911. Add poison control. Add your primary care physician's contact. Keep a digital copy on your phone. Save it as a note, or as a screenshot set as your lock screen. Also create a physical copy. Post one on your refrigerator. Place another in your wallet or purse. Technology can fail. Paper is reliable. Share this information with everyone in your household. Sit down with your partner. Sit down with your children. Sit down with your roommates. Walk them through the plan. Show them where the emergency list is posted. Explain which hospital to go to and why. For older children, practice the route. This conversation gets everyone on the same page. If an emergency happens when you are not there, you'll have peace of mind. Your loved ones will be prepared to act swiftly and correctly. This shared knowledge strengthens your family's collective resilience. Knowing where the hospital is located is only one piece of the puzzle. Your preparedness should begin right within your own home. One of the most fundamental tools you can have is a well-stocked first aid kit. This does not need to be elaborate. Adhesive bandages of various sizes, sterile gauze pads, antiseptic wipes, medical tape, acetaminophen, ibuprofen, extra inhaler if needed, epinephrine auto-injector if needed. Keep one kit at home. Keep a smaller kit in your car. Check them every 6 months for expired or used items. Beyond a kit, learning basic life-saving skills can empower you to be an immediate responder. Consider taking a certified course in CPR, cardiopulmonary resuscitation, and basic first aid. American Red Cross classes. American Heart Association classes. Learn proper chest compressions. Learn to control severe bleeding. Learn to recognize the signs of a stroke. These skills can make a monumental difference in the minutes before help arrives. They give you confidence to take action, transforming you from a passive bystander into a capable first link in the chain of survival. Create and post a visible list of all key emergency numbers. This list should be more comprehensive than just 911. Include the National Poison Control Hotline. Include your family doctor's office and after-hours number. Include the direct line to your preferred urgent care clinic. Place the list in a high-traffic area, like the refrigerator door. Make it visible to family members. Make it visible to babysitters. Make it visible to guests. Make sure everyone, including older children, knows where the list is and what the numbers are for. In a moment of panic, no one should have to search for this vital information. Think through different emergency scenarios and create simple plans. Medical emergency, while home alone. What's the plan? Child gets sick at school. How will you meet them at a clinic? Power is out and your phone is dead. What's the backup? Walk through these what-ifs now during a calm moment to develop practical solutions. Consider designating a neighbor as an emergency contact. Keep a charged power bank with your first aid kit. Mental rehearsal prepares you to think clearly and act logically when stress is high. When you travel, you leave the familiarity of your local healthcare network behind. This makes pre-trip research an essential part of your packing list. Before you even leave home, take a few minutes to research medical facilities at your destination. Use online maps to locate hospitals, clinics near your hotel or lodging. If you are traveling internationally, look for hospitals that are accustomed to treating foreign visitors and may have English-speaking staff or translation services. Jot down the names, addresses, and phone numbers of at least 2 facilities. This small bit of homework can provide enormous reassurance once you arrive in an unfamiliar place. Carry your essential medical information with you at all times. Create a small card or a note in your phone that lists your key health details. This should include any chronic conditions you have, like diabetes or heart disease, any serious allergies, and a complete list of the medications you take, including their generic names and dosages. If you are traveling to a country where you do not speak the language, it is a wise idea to have this information translated. A simple, clear summary can speak for you if you are unable to, ensuring that doctors have the information they need to provide safe and effective care. One of the most critical pieces of information to learn is the local emergency number. While 911 is the standard in the United States and Canada, this number varies widely across the globe. For example, in the European Union, the number is 112. In the United Kingdom, it is 999. In Australia, it is 000. Before you land, identify the correct emergency number for your destination. Write it down on a piece of paper to keep in your wallet and also save it in your phone's contacts. Do not rely on your memory alone, especially when you are jet-lagged or in a stressful situation. Before your trip, it is also a good idea to check with your health insurance provider about coverage for international travel. Some plans offer limited or no coverage abroad, in which case purchasing a separate travel medical insurance policy is a very smart investment. These policies can cover everything from a doctor's visit to a medical evacuation, which could otherwise be financially devastating. Be sure to carry your insurance card and the policy information with you. Knowing you are financially covered for a medical emergency allows you to seek help without hesitation, which is the most important thing. In the heat of a medical emergency, it is easy to make mistakes driven by panic or uncertainty. One of the most dangerous missteps is delaying the decision to seek help. People often downplay their symptoms, thinking it is just indigestion instead of a heart attack, or that a severe headache will simply go away. They wait, hoping to feel better, while precious time slips away. If you are experiencing symptoms like chest pain, difficulty breathing, sudden weakness or numbness on one side of your body, or severe uncontrollable bleeding, do not wait. It is always better to get checked out and be wrong than to wait and be too late. Another common but risky mistake is attempting to drive yourself to the hospital when you are seriously ill or injured. If you are feeling dizzy, faint, having vision problems, or experiencing intense pain, your ability to operate a vehicle safely is compromised. You could endanger yourself and others on the road. In these situations, the safest choice is to call for an ambulance. Paramedics are trained to provide care on the way to the hospital, and they can communicate with the ER staff ahead of time. Let the professionals handle the transport. Forgetting to bring essential information is a small oversight that can have big consequences. Bring your government-issued identification, your insurance card, and a list of your current medications and allergies. If you are helping someone else, try to grab these items for them. This information is not just for billing, it is critical for your medical care. Knowing your medical history and what medications you are taking helps doctors avoid dangerous drug interactions and make the most accurate diagnosis possible, leading to faster and more effective treatment. Finally, a critical error is choosing the wrong type of facility for your problem. Going to a small urgent care clinic for a major life-threatening event like a stroke is a waste of critical time. Conversely, going to a busy hospital ER for a minor issue like a common cold or a small cut can result in a long wait and a large bill. Understand the roles of a hospital, an urgent care center, and your primary doctor, so you get the right level of care for your situation. We have talked about why this matters. We have explored the golden hour. We have explored the different types of facilities. We have explored the simple steps you can take to be ready. Now, the knowledge must be turned into action. Life is beautifully unpredictable. We cannot control when an emergency might occur, but we can control how prepared we are. This preparation is not a product of fear, it is an expression of care for yourself and for the people you love. Small individual actions start the change. Those actions ripple outward into a safer community. Don't put this off until tomorrow or next week. The time to act is right now. Take out your smartphone. Open your map application. Search for the nearest hospital with a 24-hour emergency room. Save its address and phone number. Find a backup urgent care center. Save that information too. Take a screenshot of these details. Keep them accessible offline. This will take less time than a cup of coffee, but its value is immeasurable. It is the single most important step you can take today. Once saved, share it. Text the details to your spouse. Email it to your parents. Show your children where it's saved on your phone. Show them the printed list on the fridge. Make preparedness a family conversation. You aren't just protecting yourself. You're creating a network of informed people. People who can help each other in a crisis. Check your first aid kit. Make sure it's stocked. Consider signing up for that CPR class. These are investments in safety and peace of mind. Don't wait for flashing lights or sirens. Do it now, while things are calm. Knowing you're ready fights anxiety. You have the tools. You have the information. The only step left is to use them. Take 5 minutes for yourself and your family. Find your hospital. Save the information. Be ready. This simple act could be the most important thing you've ever done. Your future self will thank you for it. Subscribe for more adventures.